So the first topic of PYT discussion is supracondylar humerus fracture. That is very important. Supracondylar humerus fracture. So it is repeated 4 to 6 times in last 5 to 6 years of NEET PG and INICT exam. So what is supracondylar humerus fracture? So this is humerus. Okay. This is radius. This is ulna. So the name in itself suggests supracondylar. So it is the fracture above the condyle. So this is the fracture line in supracondylar humerus fracture. This is radius. This is ulna. So name in itself suggests supracondylar humerus fracture. Okay, and you will find one patient in casualty. If you start a orthopedic residency, you will find one patient in casualty in a day. So it is so much common. If you are finding one patient in a day, then it is so much common. Okay. So it is the most common fracture around the elbow in children. Okay. Now you can see this is supracondylar humerus fracture. You can see this is the proximal fragment of humerus. This is the distal fragment of humerus. Okay. Now you can see this proximal fragment is going anterior. This proximal fragment is going anterior. So there is only one vessel. There is only one vessel, that is brachial artery, which can be injured. So it is most common vessel injury. Okay. Nerve. Nerve most commonly injured is anterior anterosseous. Anterior anterosseous is most commonly nerve injured. Then median nerve. Then radial nerve. Then ulnar nerve. So this is the mnemonic AMRU. AMRU anterior anterosseous is the first most commonly nerve injured. So anterior anterosseous is the nerve injured. The patient will present with Claw-Lewin sign. Patient is not able to make the O. So anterior anterosseous nerve injury is the most common nerve injury. The classification we used is Gartland classification, bag, cafe. It is the most common classification used. Then cafe, what is cafe? CA. C is for cubitus varus. So if you, this patient has to be managed by operative fixation by using the K wires. Okay. Gartland classification is divided supracondylar humerus in three types. First type is undisplaced. You can see this is undisplaced. It is type 2 with intact posterior cortex. Type 3 is both displayed. So in type 1 and type 2, we can manage these fourth fracture conservatively by applying just a POP slab. But in case of type 3 supracondylar humerus, we have to do close reduction K wire fixation. So this is the management of all type 3 fractures of supracondylar humerus. Okay. Now let's assume a patient came in casualty and you did not operate that patient, and it is a type 3 supracondylar humerus fracture and you did not operate. Now the patient will come with, after 2-3 months, cubitus varus deformity, that is also known as gun-stroke deformity. It is the most common late complication. Okay. Fistale sign. So you can see this is the fistale sign. Okay. In supracondylar humerus fracture. Now there are two types of supracondylar humerus fracture: extension type and flexion type. So extension type is most common injury. Okay. So flexion and extension type depend on the basis on the distal fragment, which can go anterior or posterior. Okay. Now the fat pad sign. So fat pad sign is fat pushed by the fracture hematoma, which appears as lucency. That is fat pad sign. Okay. Now the complication of supracondylar we have already discussed, that is brachial artery injury, anterior anterosseous nerve injury. Now two other uh, complication is compartment syndrome and Volkmann ischemia. So what is compartment syndrome? So because this is the fracture, because of the fracture, it leads to increase in swelling. So increase in swelling leads to compartment syndrome. Increase in swelling leads to increase in compartmental pressure, which leads to compartment syndrome. Okay, and patient can also go in Volkmann ischemic contracture. because of ischemia of flexor digitorum profundus. Okay, so these are the complication of supracondylar humerus fracture. So it is very important. Okay, so these are my notes, and you can find upper limb trauma video free in my app. Download my app, Dr. Priyesh Nayak app. It is available on Play Store and App Store. So you can download app and you can access the free video of upper limb trauma. So these are the notes you can see. So upper limb trauma video you can see for the free. If you like the video, then you can purchase the course. Okay, thank you so much.